Welcome to Vibes of India. I'm Janvi Sunaya, and today we are here with yet another important conversation. With the speculation of the third wave of COVID hitting kids, parents have so many questions. From vaccination of kids, from identifying if the hospitals are equipped enough to suffice kids if they suffer from COVID, and what about the repercussions of having a vaccine? To answer all these questions, we are sitting with expert pediatricians of the city, and I'm glad to welcome Dr. Preeti Hemani and Dr. Sunil Chand. They are going to answer our questions and give us tips, give us precautionary measures on how parents and kids should go about dealing with the third wave of COVID, if at all it comes. Yeah. Welcome to Vibes of India.
Thank you.
So I mean, to start with, please tell us, is it really true or is it just speculation that the third wave might hit kids?
See, any pandemic, if we look to the history,
Yeah.
pandemic is generally, it comes in the wave.
Yeah.
So there are multiple episodes of infections. So looking to that, yes, there is definitely a possibility that we will have third wave.
Yeah.
But it's very difficult to predict the time as well as the intensity of that.
Okay.
When it will come and how severe it will
Yeah.
be. But yes, you cannot deny.
Okay.
That possibility is always there.
Always there.
Yeah.
Okay.
Actually, speculations are important for preparation. If
Yeah.
you don't speculate, you cannot prepare for that.
Yeah.
So, in case we are speculating that children will be more affected, we need to be prepared for that. We cannot lose children.
Yeah.
Since the last 2 waves, we know it's affecting children also. They are also getting symptoms, so we need to prepare ourselves for the same.
Okay.
So that's what we are going to do. We are going to prepare ourselves, or at all if the third wave comes and it is affecting more of kids, we are prepared.
Okay. But when you say about preparation, so what kind of preparation are the medical staff done with?
In the first 2 waves, the medical staff, the paramedical staff, they were not trained as much to treat kids. Usually, to treat a pediatric patient, we need a special preparation. We need people who are trained to treat kids.
Yeah.
So we are doing that. We are training staff. We are improvising ourselves. We are dedicating wards to them.
Okay.
So if at all it happens, we are prepared for that.
Okay. And what when it comes to the medical infrastructure?
Yes, medical infrastructure like our all government hospitals, they have
Enough.
Yes, the staff is trained, the dedicated, as mentioned by Dr. Sunil. We have our even pediatric ICU ready, whatever requirement of ventilator,
Yeah.
and trained paramedical staff
Okay.
and medical staff.
Okay.
This is done at each and every level. I said right from the civil hospital, Sola Civil, in the municipal corporation hospitals, and even the urban healthcare centers.
Okay.
At every level.
Okay.
And in the private area also.
Okay.
Private pediatrician also are trained into the management of COVID.
Yeah. And parents still have this confusion whether the vaccine is safe for their kids, whether they should ask their kids to have it or not, and how have the internationally people have dealt with COVID vaccine for kids. So what do you have to say on that?
Every country has anti-vaxxers.
Yeah.
In India, we are taking vaccines since birth. So
Yeah.
it's not something new we are taking. It's just that COVID vaccine is being issued as an emergency drug or as an emergency vaccine. So I would personally suggest every parent to go for the vaccine and not be reluctant.
Okay.
Anyways, we already had trial completed for children, and it will be rolled down in next month maybe.
Yes, I think at present there is no vaccine less than 18 years.
Yeah.
But there are few vaccines which we feel maybe 2 to 3 vaccines
Yeah.
will be there within a month period.
Okay.
And as mentioned that what we need to do is to educate parents.
Yeah. Yeah.
Yeah?
True. So what are the precautionary measures or what are the things that parents should take care when it comes to vaccination or when it comes to COVID in kids?
Again, for COVID, we
Yeah.
have to follow masking and
Yeah.
sanitizers, use of regular sanitizer, wash hands, and all those
Yeah.
precautions have to be done for at least another year, I would say. And for vaccine, it's like any routine vaccination.
Okay.
Like when they go for the hepatitis vaccination or BCG or any other vaccination, it's same like that. It's just we are taking 2 doses on 1 month apart, and as of now, a lot of adults have taken it.
Yeah.
I think almost a lot of people in Ahmedabad are vaccinated now.
Yes.
So we haven't seen any major reaction in adults.
Okay.
So according to studies also, there are no major reactions in children as well. So definitely, I would definitely suggest to take the
To
vaccine.
take the vaccine.
And definitely push the parents whosoever
Yes.
have been
And I think now everyone understood
Yeah.
that the way we want to prevent pandemic is through vaccination.
Yeah. Yeah.
SMS means there is a social distancing, mask and sanitization comes first.
Yeah.
Even though post-vaccination also, you can't ignore that.
Yeah.
But vaccination is the solution to come out of the pandemic.
Yeah.
So, majority, see, the vaccine whichever is going to available is more than 12 years.
Yeah.
So, it's the first phase will be 12 to 18 years.
Yes, 12 to 18, yes. So you don't think that the situation is going to be any different than vaccination for adults when it comes to vaccination for
Nothing major.
Nothing major.
I think kids will be a priority.
Okay.
So for everything else will be on hold, but kids will be priority.
Kids, yeah. But any cases that you've heard of reaction after vaccines in other countries?
People react to paracetamol also, so you cannot
Yeah.
never predict that.
Yeah.
Paracetamol is the most commonly consumed medication, but some people react to that also. So
Yeah.
you can never predict if a child will have a reaction or if an adult will have a reaction. That is solely
True.
There were few incidents post Pfizer.
Yeah.
Pfizer vaccine is there in USA. There were few incidents, but you cannot, say rationally that which it's like 1 in more than a lakh or 10 lakh. So that occurs in anyone, like anaphylactic reaction, the worst adverse effect of vaccine. Chances are very minimal, which is there even with the routine pediatric vaccination.
True.
Right? So that is, I think that is not the reason,
Yeah.
or there is no reason to worry.
True.
For that. So.
But do parents come up with like silly or bizarre question when it
Always.
comes to, if you can share
Always.
some of the cases and what are their confusions, because the people who are watching us, even they might have similar questions.
Yeah, they have the basic thing they need is like painless vaccine.
Okay, for the kids.
For the kids,
Yeah.
yes. They always want a painless vaccine. Apparently, there is nothing called painless, but anyways, when you prick a child, that pain is going to be there, and it is piercing the skin. The pain is going to be there. So they have this thing that painless vaccine chahiye.
But again, the Zydus is coming with a needleless vaccine. I don't know how it operates, but
it's just a jet of fluid you see.
Yeah.
But that's still gonna be painful on the skin.
okay.
It is a 3-dose vaccine.
Okay, the needleless vaccine.
Yes.
Yeah, if you can also explain about that. I mean, many of them would not know about it. Like.
So DNA based vaccine, but it's not yet on easily available for us. It's just in a trial. They have got the approval, but it will take another month to come in the market.
Okay.
So until we don't use it on patients, we won't actually get the feedback what's happening.
Okay. But how does it work? Like a DNA based vaccine?
So what normal vaccine has, it's just a spike protein of the virus. So once you inject the spike protein, the body starts making antibodies against it. So DNA acts at a basic level of it.
Yes.
Okay.
So what we are taking as Covishield and Covishield, they are just spike protein. So once inserted, the body has to make the antibodies. But in DNA, it goes to another basic level that it directly produces from the basic level.
So it's better for kids.
It is better. Yeah.
But again, when you go to a basic level, you have more side effects
Chances,
also.
yeah.
More
Okay.
chances.
So unless we have phase 4 data available later on, then only we will be able to come to know. But it is good. Efficacy is almost 100% against severe COVID.
Okay.
And 3 dose, I think 0, 28 days and 56 days.
Yeah. For kids.
For kids, the Zydus vaccine. Again, if we will have the Covaxin, if that which we are already using, that trial is also going on, then it will be the same 2-dose vaccine.
Yeah, will be
same as adults.
Yes. And another one is Moderna and Pfizer. If they are part of our vaccine schedule, then it will be again 2-dose vaccine, mRNA vaccine.
Yeah. But if parents are confused between which vaccine to give to their kids, like is there any advice that you would want to give if we have?
I would suggest take whatever is available rather than waiting for Pfizer, Moderna or anything.
Okay.
Whichever is available, they should go ahead.
Take it.
Because we are actually still in an emergency. We never know, the cases might start coming from tomorrow or day after.
Yeah.
So as of now, if the vaccine comes up, they should just go ahead with it, not wait for a special
For
brand.
COVID, it's like all vaccines are safe, good, with good efficacy.
Okay.
So whichever is available, one should go ahead.
Yeah. So, and doctors, do you want to burst any other myths that people might have when it comes to vaccination for kids or when it comes to COVID in general? Because it's
a lot of people have asked me that children are super spreaders, so they are not. Yeah. So
They're
children have
the
less
least.
tendency. Yeah, they have the less tendency to spread the infection. This is a common question asked that entire family got infected this time, and they blame the poor baby. But they have less chances of spreading the infection, and they don't do that much. So spreader is just like you're going to. Actually, we are the super spreader because we are going everywhere. We are going out and coming back home, and we infect the family. But kids are not.
Is there any other reason that kids are less into like?
It's just that as a kid, the immunity is not that hyper. As an adult, our immunity is very hyper. We start reacting too much.
Yeah.
So basically, COVID is an immune disease. It is affecting our immunity, and it is started. Our body is responding, and it is responding in a hyper immune way.
Yeah.
So we are affecting all our organs.
Yeah.
So
But in kids, that's not
But
the case.
one another myth is there. It was there 6 months back
6
when
months
we were not having the second wave. People were not thinking about COVID in the child.
Yeah.
I
Exactly,
came
yes.
across few families
Huh.
where child had fever, cough, cold, and when we say that you go for COVID test, they say no.
બચ્ચાને તો કઈ રીતે
ઘરે કોઈને નથી, you know, so nobody is having, then the child is less likely to have, and sometimes it has happened that the child was COVID positive, then we tested other family members, and then they were also positive.
Okay.
So it's a, you know, both way.
Yeah.
The child can be asymptomatic for few days,
Okay.
and another family member develops symptoms, and when we do testing, all of them are positive.
Yeah.
So it is like child also, they are prone for COVID, usually mild or asymptomatic.
Yeah.
But then they should be treated properly, taken to the hospital, because you never know which child will have moderate disease.
Yeah.
Incidence of severe disease is very less in pediatric patient, so sometimes family ignore,
Yeah.
you know. Or what another problem that we have seen, that father is tested positive, mother is also there, then they will send child to grandparents' house.
Yeah.
We always discourage that. Then
Yeah,
child
exactly.
is already exposed. He is not, or she is not going to have any problem.
Yeah.
Rather,
They're spreading it.
Yeah,
Yeah.
they will spread to grandparents and they will develop severe disease.
Oh.
So that is one thing.
So that
which
did happen in first and second wave, but sometimes
happened,
people
yeah.
ignore.
it happened a lot.
Okay.
Then gradually people realize, and then they stop doing it, you know.
Okay.
Initially in the first
The
wave,
first
yes.
is also think that it is gonna spread through fomites also.
Yeah.
हाथ
Yes.
से या किसी भी
Yeah.
फैलेगा
Yeah.
तो
So-
and they go to grandparents' house with all the stuff. And
Yeah.
Yeah.
And it.
So
Okay.
and once it is there in a child less than 5 years old,
Yeah.
parents are very hyper.
Yeah.
They worried a lot.
Yeah.
So first counseling is like, this is like any other viral disease.
So even
no need
counseling
to-
parents is required.
It is.
A lot.
Must.
Okay.
in COVID,
Actually, pediatrics
yes.
is all about counseling.
Yeah.
Okay.
Less of medicine.
Less of
But
medicine.
most of the time you're just convincing parents that they should.
Exactly.
Is that the situation
Yeah,
now?
yeah.
Yes.
But do most parents are reluctant to giving vaccines to their kids? Like it's,
Actually, more than reluctant, they are afraid because
Yeah.
the parents now are very possessive over the
Yeah.
things, so they
True.
like for everything they are afraid.
Yes.
If I may.
okay.
Also,
In general,
in
yeah.
general. Yeah. And one common thing is that everyone wants a 100% guarantee that after vaccine,
Yeah,
the
their
disease won't
child is
happen. So the
safe.
role of any vaccine, be it COVID, be it BCG, it's to reduce the mortality
Yeah.
and morbidity.
Yeah.
That
it's
we are
not
reducing the suffering and whatever the complications will happen, that we can reduce. But no vaccine will say that ये disease नहीं होगा. You
Okay.
take any vaccine. So we are just preventing that. Already in antibodies तो infection होगा तो it will be mild.
Yeah.
That's what we are doing. We are not
True.
giving a 100% guarantee कि ये infection नहीं होगा.
Yeah.
So that lot of parents have that कि they vaccine ले लिया तो
Vaccine ले ली तो.
Another thing is, we counsel parents that you are waiting for COVID vaccine to come.
Yeah.
So don't ignore other routine vaccines. They are equally important to build up the normal immunity.
Okay.
So that is one counseling which we do to all the parents, that you continue with normal immunization schedule.
Yeah.
Whenever the COVID vaccine will be there,
Yeah.
we all pediatrician, we know what are the duration, how
Yeah.
much the gap is required.
Yeah.
So that counseling we are doing since last 3-4 months.
Yeah, because the gap in adults and kids is very different.
No, it's a 1 month gap generally.
Yeah.
One is taking COVID vaccine.
Yeah.
So that counseling we are doing for more than 12 years.
Yeah.
Those who are due for boosters.
Yeah.
And we are saying that you have to take your routine vaccines.
It
Yeah.
So
happened
please
in first
ignore.
wave. They were
Yes.
ignoring their routine vaccinations.
Yes,
So
routine
no one was
vaccine.
coming up.
So it will lead to another epidemic of measles or maybe a flu, which we are seeing right now.
We are
Yeah.
seeing measles
We are
and flu
seeing
full on.
flu full.
Okay.
So right now we have major emissions are because of flu.
Flu
because
Okay.
virus.
Flu vaccines are not taken routinely, and because
Okay.
of that, flu is very much there right now.
So by what percentage has the patients increased when it comes to?
So right now we
Other
have a lot of
disease.
flu patients and a lot of dengue patients. Dengue
Okay.
we don't have a vaccine right now, but
Yeah.
for flu we have vaccine. At least that will prevent the severity. They won't need
Yes.
admission to a
Oh,
ICU and
I
all.
see.
So
Yeah. Okay.
vaccines that way are very helpful.
Okay. And when it comes to adults took so many things to build immunity before COVID, out of panic or sometimes out of like precautionary measure. Is there anything that we need to do for kids as well? Like anything
Yes.
when it comes to...
See, first of all, we say that you have to don't give extra multivitamins also. Good balanced diet and some sort of exercise, whatever
Okay.
is possible.
Yeah.
Keep child away from screen.
Okay.
Some family time, indoor, they can do lot of activities, some physical activities, which will be very important in preventing extra weight gain.
Yeah.
And it is essential.
In lockdown, this has happened.
Yes,
A lot of
it
kids have
happened.
become,
But
they
it's
have
so
gained weight
difficult
and
because
all.
they are
Yes.
doing schools
Yeah.
online, so you
Yeah,
can't even
Exactly.
keep them away
So that's
from
what you have to entertain them
Yes.
at home only.
At home.
That's
Yeah.
the only
So
option.
that is what is that was important. Again, COVID appropriate behavior in parents.
Okay, yeah, that's what are the things that they should take care of, like parents, when we say COVID appropriate behavior?
Same as not to socialize that much. Keep kids away.
Yeah.
So what you do, your kids also see.
Yeah.
So when you're always in the screen, he will also learn the same thing. I think
Yeah.
online classes ke वजह से it's become more common that child is studying or all
Yeah.
this Byju's and everything.
Yeah.
Everyone is studying online only. So the screen time has to be balanced with
Yeah.
your physical activity also. But now we see a lot of kids who have gained significant weight
Yes.
as per their height and all.
Yeah.
So
So
that will lead to
obesity in
another
kids
disease.
is also another...
Is there, and more than 12 years where we are targeting COVID vaccine, they have gained lot of weight. And once they have adolescent age group COVID is almost like adult.
Yeah.
Adult COVID.
Yeah.
It mimics adult COVID. So in that case, sometimes we see severe COVID.
Okay.
So we are very careful in counseling adolescent patients.
Okay. So if kids are obese, then the impact of COVID can be severe. Is that what?
Any patient who's obese will have a more impact.
It's high risk category.
Yeah.
It
it's
is
a
a
high
risk
risk
category.
category.
So
And also it's like we are not body shaming kids and all. It is just a thing that we need to take care of. At this age, if they gain so much weight, it's very difficult. The entire lifestyle become very slow and all. So we need to keep them active, at least
Active.
physically.
True. Very true.
So it's a awareness and to impose good lifestyle.
Yeah.
Lifestyle related diseases will be, I think, of significant
Yes.
numbers in coming 1 or 2 decades. I
Yeah.
think.
Again, rather than being fit, it is being healthy.
Healthy.
Yes,
That's
yes.
you need to differentiate
Yeah.
and work
Exactly.
accordingly. True. And another question that parents have is whether to send kids to school or not. Is it too early or is it safe? It is not safe. As doctors, what would you recommend?
So the thing is that they are also losing on their social
Life
social touch and
and,
social
yeah.
life. So expecting kids to go into the school and wear mask and all, that is not something we can control.
Yeah.
They are meeting their friends after 1.5 years. They are gonna go hang out. They're gonna go play everything.
Yeah.
And they cannot be with football, like playing football and all. They cannot wear a mask and play all those things.
Yeah.
So sending to school is a very difficult decision to take. And we can never be sure because this has been since last two years. It's been very unpredictable. We cannot predict.
So even as
And-
doctors, it's not.
But one thing is like we can do some sort of study. There are few studies or data published. One, Indian Association of Preventive Social Medicine.
Yeah.
They have done some survey and they figure out that children also affected same way the adults in first and second wave.
Okay.
So majority of them had asymptomatic or mild symptoms and suffered COVID. Now if we guarantee that it will be a good COVID appropriate behavior in the school, the school staff is vaccinated, then kids can go without vaccine into the school, but not
only-
very young.
Yeah.
Maybe 6th grade onwards,
Yeah.
which we are already having right now. Yes, that is, they can do it with 50% attendance, some sort of
Social
norms.
distancing.
Yes, should be there, strict norms. That alternate day or there is different shift. With that, school can open function, because otherwise it will be mentally and physically both and socially also kids will lose on many areas.
So not against it, but we
But
need to
also
take
not
care.
pro.
But it's like trial and error.
Trial
We
and
open and review.
Yeah.
It should be reviewed.
True.
Then there won't be a problem.
Yeah. And there are speculations that in coming next 3 months, Zydus might roll out their vaccine for kids, and their efficacy certificate will come after 6 months. So what do you have to say on this? Like, if parents are concerned about this, like, should they like go ahead with it, or they should doubt, or like?
So again, I said whatever is available, you should go
with it.
But definitely, you can. If you want to wait, it's up to your choice. But
Okay.
I would say in the emergency we are in, we should just go ahead with whatever vaccine is available for kids
Okay.
to get back to normal life.
Yeah.
So until unless we are at least 60 to 70% of the population is not immunized, we won't have herd immunity.
Okay.
So to have that, we need to
Yeah.
vaccinate, and kids are 30% of our population.
Yeah. So it's
it's a
Big number.
Yeah. True.
It's a big number, so
Yeah.
we need to keep that as a priority.
Yeah. And as doctors, is there any different way you have to deal with a kid who is COVID positive? Like, you might have got such cases, or you might not have, but is there any other?
Like
Just the thing that we don't isolate the child. We want someone around.
yes.
Yeah.
Because it's difficult to.
Very
In adults, we isolate. We don't
Yeah.
allow anyone. But in kids, it's difficult to keep them in a.
If
isolated
adolescent
Yeah.
age group, then it is possible.
Yeah.
Yeah, then we are doing. Like we have infant,
Yeah.
then we continue with breastfeeding.
Yeah.
Mother and child together.
Together.
We
would
counsel parents regarding the mother, regarding how to breastfeed, what
Yeah.
care she should
Yeah.
take.
Social approach.
Socially, how they it is almost same.
Yeah.
But yes, what I agree with Dr. Sunil is isolation
Is-
will create lot of problem.
True.
Anxiety.
Anxiety in a child.
Yeah.
So yes, more than 10 years, and happily they are ready to stay in the
Isolate,
separate
yeah.
room, then it's fine.
Okay.
Otherwise,
Otherwise-
it is not necessary.
Yeah.
We advise them that it should be 6 feet distance. Mother and parents,
Okay.
child and parents,
Parents
they can be in same room.
We had a lot
Okay.
of mothers who were COVID positive,
Yes.
so we were not able to. We cannot separate child from mother.
Child
so
from
we
mother.
continued the feeding and.
Yeah. So that will be different when it comes to adults and kids.
In kids, yeah.
in kids.
And less than 2 years, they can't wear mask.
Yeah.
So those are issues
Yeah.
which we see in less than 2-year-old.
Okay.
So, but in that
Yeah.
case also, we have to train mother
Yeah.
that she should wear N95 mask.
Yeah.
What other precaution they will take?
True. So, as kids can't wear masks, like if they're really small and they are not able to take all the precautions, it's only parents who can wear masks. Is there anything else that we can train kids to do, or not?
It's always
much?
good to teach them cough etiquette early in life.
Yes.
It's not about COVID, it's about many diseases which are
Yes.
spread through coughing and all. So it's
Okay.
always good to teach them cough etiquettes,
Okay.
how to cough and how to pipe it
Yeah.
and everything, and how to clean their hands and everything.
Okay.
That has to be taught early in life, so it goes long way.
Okay.
So basically we lack cough etiquettes. Like when you come to a hospital, you'll see a lot of people put their mask down and they'll cough and then wear
Yeah.
it. So what's the point of wearing that mask?
Yeah.
So we need to teach that not to kids but to adults also.
And
So-
what I have noticed is kids are very good when it comes
Very
to mask.
corporate actually.
When they come to OPD,
Huh.
I hardly have seen any of kids. They will not remove their
won't
mask.
remove
They will ask
Yeah.
mother that should I remove.
Oh.
They are really good if you teach them properly.
Yes.
So
Yeah.
that is, I agree that if you have said certain things, and now there are such a good different masks are available, so it's like a accessory.
Yeah.
So there are kids,
Yeah.
they really like
Like
different
it.
colors
Yeah.
and
Yeah.
colorful masks. So they follow.
True.
They follow and they are very good
True.
in following all the rules.
Yeah.
As far as the COVID, we
Yeah.
had a real good response from our
From-
patients.
Yeah.
Actually, positively.
Positive, yeah. It
Okay.
was
That's
not
very
that
interesting
difficult.
to know.
Yeah.
And can there also be any psychological impacts of like COVID in kids, or it's too early? Is it too early to predict?
It's the surroundings you provide them. If you just
Okay.
keep tane COVID se, tane COVID se, so
Ah.
for adults also I'm saying the same
Ah.
thing. If you keep bombarding with the same thing, tane COVID se, out se,
Ah.
aate hi unde hi. So you need to
So
change
it-
that. Yeah, you
it's-
don't, because you are giving them anxiety, and then anxiety later leads to psychosis.
Okay.
So you need to make sure that they are, they are being well taken care of, and it's nothing major, and it's about creating a positive surroundings for them.
Okay.
So for anything, be it COVID or any disease, you need to give them positive vibes only. So
Yeah.
if you keep telling them ki
Yes.
out hai unhe, aat hai unhe, so that
And
is
in
not
second
gonna-
wave, it happened also.
Yeah.
Those who are more than 10 years, the adolescent age group, they
Was
access social
scared?
media,
Huh.
they know So we always say that stay away from social media and news. Lot of negative news going on, so they do not differentiate that the why the some death in the family or in the neighborhood, they will not understand the comorbidity, what happened. So it's better to educate them. Otherwise, yes, lot of negative vibes goes to them. So it is very important.
Okay.
So
Interesting.
So last year kids were inside the house locked for 4 months.
Yeah.
That is definitely going to affect their thinking.
Yeah.
and another is the fear that they should know that it's going to end.
Yeah.
If we behave properly, yes, if we use vaccine, if
take precautions,
it will be, it's not that the COVID is not going to end. So there was a time in between, and again the schools, online school, the exams not happening. Yes, lot of other factors. For the kids, it's not only COVID. It's not only COVID, multiple issues. So you have to, I think, give attention to each and every issue, because you never know which reason is causing anxiety in the child.
True.
So with COVID, rest of other small issues are very important.
Okay.
Yeah.
Any last bit that you would want to add? Something that any message to parents when it comes to?
No, I'll just say don't panic. Go for the vaccine, and it's definitely gonna help in the long run. Nothing to worry.
Yes, I think over a period of time, COVID will be endemic.
Yes.
So let's hope for the best.
Nothing lasts forever. So
It's like we have to follow the saying that prepared for the worst, but hope for the best.
Hope for the best. Yeah, I think we can go with that message, because parents are really terrified when it comes to, as you both have experienced more than I would have. But we do spread the message of that people should go for vaccination and trust the doctors and science when it comes to vaccinating the kids. So yes, thanks to both of you for joining us today, and I'm sure all the viewers have also got a lot of insights when it comes to COVID in kids. So for more such interviews, please watch Vibesofindia. Thank you so much.